So my name is Brian Shafer. I'm an orthopedic surgeon here at OrthoArizona, and my specialty is sports medicine. I'm one of the team physicians, team orthopedic surgeons for the Los Angeles Dodgers, both here in Arizona and in Los Angeles. Today we're talking about Tommy John injuries, which are actually ulnar collateral ligament tears of the elbow. We see them most in throwing athletes, in particular high-level throwing athletes like high-level baseball players, pitchers most commonly, but all throwers really. The injury the surgery was named after Major League Baseball professional pitcher Tommy John, who had this injury in the early 70s. Prior to him and the surgery done on him, an ulnar collateral ligament tear, which is a ligament on the inside of the elbow, was thought to be a career ender. It was a career ender for any high-level thrower, especially a professional baseball pitcher, and even any throwing athlete. In the early 1970s, in particular 1974, Tommy John sustained this injury and tore his ligament on the inside of his elbow, and Dr. Frank Jobe at the time was playing with a new operation where you take a tendon from another part of the body and make a new ligament on the elbow to restore the structure that is torn in an ulnar collateral ligament injury, these injuries. And he was playing with that procedure, and Tommy John didn't really want to accept not throwing anymore and retiring from baseball, so he asked Frank Jobe to try that on him, and so he was the first person to undergo an ulnar collateral ligament reconstruction, similar to the way we do it today. It turned out to be successful in him, and he returned to pitch for another 13 or 14 seasons after that operation. We then named Tommy John surgery, which is what you hear about it in the press today. It's probably the most common injury and most common surgery that we do on throwing athletes, especially in professional baseball. And again, it's an injury to the ligament on the inside of the elbow that occurs because of the force that is across that ligament. There's an enormous amount of force that's created when you throw a baseball on that side of your elbow and on that ligament in the elbow. And it's a ligament that actually in normal day-to-day life, you can have a tear in it and it doesn't really cause too much dysfunction or pain. But in a high-level thrower that needs to create that type of force across that part of the elbow, even sometimes small tears can cause lots of pain and the inability to throw at that level. When that happens, then these athletes can't throw at the level that they did without significant pain. We diagnose them. In addition to pain on the inside of the elbow with throwing, we use MRIs to diagnose them. And if you look here, we have an MRI of an elbow, and this is the inside, what we call the medial portion of the elbow on this MRI. And what ligaments do is they connect bones together, and there's a ligament on both the outside and on the inside of the elbow. And here is a good normal ulnar collateral ligament that goes from the top part of your elbow, what we call the humerus, to the ulna, which is the bottom part of your elbow. And it's a thick black structure that goes from one bone to the other. Again, that tremendous amount of force goes across that ligament when your arm's in a throwing position. That's a good intact ligament. But if you look at this other image over here, it's flipped, but on the other side, this black structure that's supposed to go from the ulna to the humerus is disrupted here, and it's torn and pulled away from the bone. And so that's what we would see in a sudden acute injury to a thrower. Feels a pop and sudden onset of pain on the inside of his elbow. MRI would look like that. When we see this type of injury, what we recommend is, again, the Tommy John procedure or the ulnar collateral ligament reconstruction. What that means is we take a tendon either from the wrist, which is called the palmaris tendon, which is a tendon that is present in most people, not everyone, but most people, and it's a tendon that doesn't necessarily need to be there. There are other structures in the wrist and the forearm that perform the same function. So we take that tendon, causes no disability to that area, and then we weave it through bone tunnels in the elbow from one side of the elbow to the other, from the humerus to the ulna, and reattach it on both sides to make that new ligament. And that's what an ulnar collateral ligament reconstruction is. After that operation, it's on average between 12 to 15 months before a high-level thrower will be back to competition, especially a pitcher Pitchers generally don't get back to the mound until 11 or 12 months after that operation and aren't competitive pitching in games until somewhere around 13, 14, or 15 months. So it's a long rehab process that we start around 3 or 4 months with throwing. After the initial trauma of surgery is subsided and range of motion and swelling is all restored to normal. And then we progress very slowly back to throwing to full levels from month 4 to, again, that month 12 to 15 time period. It's a very successful operation at restoring function in throwers. Somewhere around 85% or more will return back to the same level of throwing that they were at prior to their injury. And again, very common injury that we see in throwers, especially college and professional baseball players, and even now some in high school kids. We start to see it as the volume of baseball increases.